I'm Dr. Aiswarya Yalamanchi, consultant endocrinologist. Unlike chemical messengers in the body, which are produced by endocrine glands. These are certain glands which produce these chemical substances, which can be produced at one site in the body and can travel in the blood to other target organs or tissues and tell the body what to do and when to do certain functions. They majorly regulate most of the bodily processes, and these hormones usually need to be in a particular range and or a level. So too little of this hormone or too high of this hormone can lead to hormonal imbalance. The hormonal imbalance can lead to many conditions, of which some are feeling tired, feeling easy fatigability, period problems, difficulty to get pregnant, having sleep disturbances, emotional turmoil. These are certain things which can be expected in a person who is having hormonal imbalance. So the causes of hormonal imbalance can be many. Sometimes certain medical conditions can result in problems in the endocrine glands, which can result in this hormonal imbalance. So the other more common causes of hormonal imbalance are lifestyle habits, environmental conditions, any conditions associated with endocrine malfunctions, such as growing some tumors or some nodules in those glands, or functional problems in the endocrine gland. Women can experience hormonal imbalance at predictable and naturally occurring points in their lives, them being menstruation, puberty, pregnancy, and menopause. So, certain causes can be like having a higher percentage of bodily fat, person having type 1 diabetes mellitus and type 2 diabetes mellitus can also lead to an increase in risk of other hormonal imbalance such as thyroid and PCOS. Some hereditary conditions which can be passed on through the genetic problems, extreme infections, toxins, pollutants like herbicides, pesticides, severe allergic reactions, abuse of anabolic steroid medications, phytoestrogens such as soy products, birth control medications, benign tumors, which are like known as small nodules in their endocrine glands, cancer, chemotherapy, and radiation. These all can affect your endocrine glands and lead to hormonal imbalance in the body. So the hormones usually affect the quality of life in both men and women. The hormonal imbalance can result in many symptoms which can be similar in both men and women. So looking at the symptoms, patients with this hormonal imbalance can present with symptoms like feeling lazy all the time, feeling hungry, gaining excess weight even though they're following a healthy diet and lifestyle. Sometimes they can have energy crashes. They might feel sleepy even after having a good night's sleep, or feeling difficulty initiating the sleep, or they might need to rely on caffeine throughout the day to get them along with their work. The certain hormones, such as sex hormones, can also take a toll on the health of men and women. Men can experience decreased sex drive, erectile dysfunction, and difficulty in growing beard or building their body mass. In case of women, they can present with low sex drive, vaginal dryness, which can make intercourse very difficult and uncomfortable for them. In case of menopause, where the women sex hormones go very low, they can experience hot flashes, night sweats, mood swings, and problems with bones such as bony pains and bone strength loss. So the other hormones the other hormones imbalance can result in problems like feeling anxious or depressed, and stress can be overwhelming for some people. The treatment of hormonal imbalance usually depends on what is the factor which is causing it. If you have lower than normal hormone levels, the main treatment is replacing the hormone which you are deficient. For example, in a person who is having low thyroxine hormone, we usually tend to give thyroxine hormone to treat that condition. Other specific for the type of hormone in question and its related effect should be given to the person who are having such problems. In some cases, medical therapy might not be effective, in which conditions we might need to consider other types of treatment or modalities of treatment such as surgery to treat the imbalance. Apart from the medical and surgical treatment, following a healthy lifestyle such as eating a healthy diet and regular exercise can help in certain hormone imbalance conditions such as PCOS. Try to avoid using unregulated natural fuel or over-the-counter products which can be harmful than doing to the patient. To prevent hormonal imbalance, I suggest people to start maintaining a healthy weight by following or eating a balanced healthy diet, need to exercise regularly, at least 3 times a week or half an hour every day, and try to manage your stress in a better way. Try to calm down your nerves, take breaks or time off with the conditions which are causing stress, getting enough quality of sleep, such as 6 to 8 hours of sleep every day regularly. Try maintaining a sleep cycle. Sleeping at the same time every day and wake every day at the same time usually helps a lot. And it's better to go to sleep before 11 o'clock and wake up early in the morning, because there are certain hormones which tend to come up or rise their levels in the morning and which need to go down during the night. In shift workers, we have observed this, that the stress hormones which need to be low during the night are in a higher concentration in the blood. So what happens because of this? This can lead to a hormone imbalance and increase in the risk of conditions such as diabetes mellitus and PCOS. And it's also important to manage chronic health conditions which can affect the hormone imbalance. And if smokers, try to quit smoking or using tobacco. Regular monitoring and taking precautions in people who are at high risk of getting conditions such as diabetes mellitus when there is a family history.